Hello, Dr. Ramin. Hello, Damien.
Good
Hello,
morning.
guys. Hello, Amin. Hello, Mohamed.
Hello,
How are you
everyone.
guys? Good.
Good,
Great.
all good.
Thank you for the invite.
Yeah,
Yeah, we're glad to be
we're
here
very
and
excited.
exciting project. Healthcare, AI. That's a big topic, and we little bitly talked about it last time in our talk, and but we'll go into deep with you today, and we're very glad to have an expert like you, Amin, on board.
Thank you
Yeah,
very much. It's my pleasure, my honor to be here. Thank you.
thank you. So let me start to introduce you, Dr. Rami, for our audience. Then we can start our conversation. I would like to share with our lovely audience, Dr. Ramin Rafie is a physician leader and healthcare consultant with an experience in artificial intelligence and his applications and its applications in medicine, and a pioneer at what we call hospital at home, which is a new thing for me. I would like to learn more about it from you. Beside that, Dr. Ramin as well, he's a member of the top 1% ACO nationally, and he's certified in the AI from abAIM.org. Thank you, Dr. Rami, for accepting our invitation, joining us in this conversation. Please share more details about your experience, your background in healthcare. I know this is a very hot topic now, and as Damien said, it was open the discussion about healthcare last time.
Right. Thank you for the invitation, Mohamed and Damien. So out of medical school, I ended up becoming a primary care physician. And out of residency, I joined a group making house calls. And the company I joined was actually the nation's largest house call company. And it had presence in about 8 states. And during our time working, Medicare was experimenting new payment models, and they were launching a national study. One of their studies was the Independence at Home study. So it was actually a study to help encourage people age at home, but still get the medical care that they need. And there were organizations from all over the country, a lot of academic medical centers that were participating in this study. But we were the largest private group in this study. And we basically, there is about 8% of Medicare's population that costs Medicare 80% of their budget. So the healthy 90% of the Medicare's population actually only costs Medicare 10% of their budget. So for Medicare to be viable, they need to really target this 8%. And this 8% are people with chronic conditions. Most of them do not have primary care doctors. They treat the ER as their primary care doctor, and they end up costing the healthcare system a tremendous amount of money. So what we did is we basically provided care in the home to them. Instead of them going out and it was difficult for them to get out, we would see them in the home. We would treat their illnesses in the home, preventing a lot of hospitalizations. And if I was to go and see a patient 2-3 days in a row, it might cost Medicare $400. But ultimately, if I saved one day in the hospital, 20 years ago, one day in the hospital was $1,000. Today, it's probably 10 or 20,000, depending on what level of the hospital you're at. Wow. So by preventing these hospitalizations, we save Medicare a tremendous amount of money. And we helped establish the hospital at home model of care that Medicare passed a waiver for in 2019. So today there's 127 medical centers throughout the country, and there are actually organizations throughout the entire world, in Europe and in every developed country, that are developing these hospital at homes models of care where the doctor comes to the home to see the patient. Now, the truth is, in some of these models, depending on the hospital and the country, it's not necessarily the doctor that's coming into the home. It might be a nurse practitioner, but ultimately these nurse practitioners are supervised by doctors as well. But as technology advances and there are more people aging, the vast majority of people, if they're given the option of receiving care at a doctor's office or in the home, most people would opt to get it in their home. And this is not going to replace hospitals. This is basic primary care in the home. And the hospitals will still say active, but they are more for the acutely ill. They're more for surgeries, and they're more for the ICU patients. This is for just general basic medical care. So this is happening not only in America, it's happening all over the world. And as technology advances and there is more advanced technology, not just in the computers that we use, but in medical technology, and all of this is expedited by AI, it will allow there to be more technology and better care being provided for in the home. So one example of that I'm also an advisor for is in the remote patient monitoring space. There are a lot of companies in the RPM space, and Medicare in America only started reimbursing this in December of 2021. So I don't know why, but in the middle of the COVID pandemic is when they approved the funding. I think they probably had this in the plans years before, and it just takes them so many years to adopt it, and it just happened to fall during COVID that they still pushed it through. But nobody really knows, because who knows what Medicare is thinking. But a lot of doctors out there are not aware of RPM technology. And part of that is the RPM technology is still entrenched in the Medicare and the insurance-based system. Most doctors that come out nowadays, especially in the primary care fields, they opt out of Medicare and they go into direct primary care, which is not dealing with the dysfunctional of the Medicare system and the insurance system to make their own life easier. So because of that, there actually is a lack of traction for this RPM technology, and there is a lot of lack of adopting these AI technologies, because I think a lot of it is misunderstood. People make the comments that AI is going to replace doctors and it's going to take over our jobs. And I really don't think that's the case, because at the end of the day, just like money is a tool, AI is a tool, and AI's job is to make our jobs easier. And what this does, actually, this affords a tremendous opportunity for physicians, because there are very few people that have the training of what a doctor does. And there are very fewer doctors that have that training coupled with a specialization in AI. And if you just get that little certificate in AI, that puts you in a very small niche. ABAIM meeting that I was in Orlando this 2 months ago, Anthony Chang, who leads the ABAIM, made the comment that there are less physicians certified in AI than there are astronauts, and currently there's 676 astronauts. So it puts the doctors in a very small niche and allows them to become very desirable and very marketable, because there's very few people with this combined skill set of healthcare, AI, and then I got an MBA as well. So I have I would say, a deeper understanding of finances, and ultimately everything is driven by money.
It also opens because when we're talking AI, people are all scared to take their jobs. But what you're saying is like there will be even more jobs on this specific.
Correct.
There's so few, and the impact can be so huge. Like you were saying, like you're not even at the Pareto law, like you said. It was 8%, 92, and if you solve this 8%, if you gain 1% of improvement in this 8% in with AI, through AI or through people like that, it's huge amounts of money saved and could be invested. You know how money works, invested in somewhere else. So that's that
That's
was
right.
very interesting what you just
Yeah.
all said.
That's very interesting. Let's get step back, because as you said, Ramin, most of the people are talking about the AI that it's coming to take over or to replace doctors or healthcare, and even public people. Sometimes they're still not confident and trusting the AI results whenever we're talking about healthcare and their health. But let me ask you this question: How do you see and define the role of the AI transformation for the healthcare industry? How this is potential? How it is actually working?
So it's going to work different ways in different fields. The lowest hanging fruit for AI is the image rich fields like radiology, dermatology, ophthalmology, pathology, because those are images that AI can very easily understand, it can train on, and it can help develop systems. So that's the lowest hanging fruit for AI to help in medicine. And that's probably the biggest area of AI in medicine is in radiology. What I do, which is primary care and hospice medicine, there's a tremendous amount of what's termed as unstructured data. The data is not images; it's verbiage, and it's a matter of opinion. And ultimately, it's my opinion that I've gained through 16 years of patient care. And after 16 years of patient care, I still come across diseases that I've never learned about, I've never seen before, but still out there. These are called zebras. And in the field of primary care, AI is more so going to help, I think, with the interoperability of EMRs. Currently, healthcare has big silos. When a patient goes into a hospital, the EMR from one hospital generally does not talk to the EMR of another hospital, even though it could be in the same city. I went
Yeah.
to UCLA for college, and I went to UC Irvine for medical school. I personally consider the UC schools amongst the best in the country, and the UC hospitals to be amongst the best in the country. And when I became a doctor, all the UC hospitals, UCSF, UCLA, UC San Diego, UC Irvine, were not on the same EMR. Years later, they all got on the same EMR. Even though they were on the same EMR, they were not communicating. So when a patient was at UC San Diego, and let's say they wanted to get continued care at UCLA to go see another specialist, even though they were on the same EMR, the two EMRs were not communicating. And that's just because there was a lack of interoperability. So what's happening now is by 2030, there's a mandated that all the EMRs, all the systems need to be interoperable. And currently there's two big EMRs. One is called Epic, which has about 40% of the market. And the other one is Oracle, which bought Cerner, and that has about 35% of the market. So those two have about 75% of the market. And both of them are making tremendous strides internationally as well. And then the remaining 25% of the market are these smaller mom and pop companies. But that's another big role for AI, is to facilitate all this interoperability of EMRs as patient moves from one system to another health system.
Yeah, the treatment of the data, and also automation between all of them.
Yeah, I'm going to just give one quick example that gave an example of how a national EMR system, if there was one in place, and how beneficial it would be. Back in 2006 is when Hurricane Katrina happened. When Hurricane Katrina happened, there was a lot of people displaced, and there was people from New Orleans that went all over the country in other cities, and there was people from very different demographics. The only group of people that continued to get uninterrupted healthcare were the veterans, and that's because the VA had the same EMR system no matter where they were. And it's a government-funded health system, the VA has a tremendous amount of problems because there's tremendous inefficiency in it. But at that point in time, they actually had the best EMR because they had one EMR for all their hospitals in the entire country. And whether you went to the VA in Long Beach, California, or the VA in Detroit, Michigan, it was on the same EMR and they all talked. So this is kind of a no-brainer, but the way the healthcare system is designed, it encourages a lot of independent players, and these players are all trying to vie for more market share, and it actually makes the system be very inefficient. And right now you have Epic and Oracle that are the two largest EMR players, and as there's more and more consolidation amongst hospital systems, more and more hospital systems are adopting Epic and Cerner. I have not used either one, but from what I understand, both of those EMRs are adopting AI assistants that are built in so that the doctor can just talk to the EMR and no longer have to spend so much time typing and clicking. And that was one of the problems is when they launched the EMRs nationally, the EMRs were really not designed by physicians. And instead of making physicians' lives easier, it actually made everybody's lives a lot more difficult because something that should have been so simple, like putting an order in a computer, became way more cumbersome. It gave more chances for mistakes to happen. And this was and it still is a big source of burnout for physicians out there.
Yeah, that's okay. You went through blocks, and we talked a little bit before. That's a concept. Maybe you can go a little bit deeper. Like we talked about a hospital at home. It's I don't want to say new trend, but it's something that will be able maybe to scale, and also I think maybe economy of cost on it, and that's where I think AI has a spot. But you're the one to bet. Can you like explain us a little bit more of this concept and how AI will be embedded in that, and what's the benefits out of it, like of this concept hospital at home?
Well, so the vast majority of the healthcare system, not only in America but in other countries, is subsidized by the government, and ultimately everybody pays for it. And it's taxpayer dollars. It's Medicare system, and it's in everyone's interest for this to be an efficient system and not be wasteful. And that's the big role of AI. The AI can help minimize the administrative burdens if it's done correctly, and make the job of a physician easier, and in time hopefully improve patient care. Currently, the healthcare sector in America is, I believe, $4 trillion. It's 1/5 of the economy. The U.S. economy, I believe, is 19 or 20 trillion. There's no other sector that comes close to being so large. The defense budget of the U.S. is $88 billion, and the U.S. healthcare system is $4 trillion. In that $4 trillion, there's a tremendous amount of waste. And for spending that kind of money, everybody in America should have concierge level care, but that's not what's happening. There's a tremendous amount of inequalities. There's a tremendous amount of inefficiencies. And, if you utilize technology correctly and you leverage it correctly, it can help even out the playing field.
And for you, like, is it like more on the diagnosis or more on the like visual treatment, like on your prescription? How does the AI, or it can have all of this field? It's so huge that you can all of them, right? Yeah, all the scale of your disease,
That's right.
even it's at home, and also connected to the device. If it's hospital at home, I suppose like you can have a device at your home that monitors everything, and we can have like a layer of AI in between that can like make more if instead of having like 5 people like trying to check the data of this patient, like AI will do that work, right? That's how we understand.
That's exactly right. So the AI can act as an intermediary. If the AI works as an intermediary, and then if it notices there's a concern, then it would flag a provider or a physician, and that is a much better utilization of somebody's time. That's what RPM does.
And I suppose there's a huge there's a huge, let's say, road to achieve here, because it's an open door, right? We're just at like what 5% of what can be done, I suppose, or I don't know the number. You may,
Yeah,
because
I mean, I would say AI.
very early stage. Yeah.
I would say AI in medicine, we're in the bottom of the first inning of 9 innings. So
Okay,
even though
just
I've been,
starting the game.
yeah,
Just starting the
it's
game.
just the beginning of the game, and
Yeah.
there's a tremendous opportunity for physicians to become leaders. You know, the way the healthcare system is designed is people who become doctors. First of all, we're not called doctors, we're called providers, but we ultimately become employees in these health systems. And people become very frustrated that they go through all these years of schooling, all these years of training, and at the end of the day, they're an employee. It's somebody higher up above them that makes the decisions.
Yeah.
This person higher up is not a clinician; they are an administrator. And by leveraging knowledge of AI, it allows the physicians to gain leadership positions, not just within these health systems, but outside companies that are trying to develop these AI technologies that need expertise in developing and leading this niche.
Interesting. That takes me to the next point, which is related to the RPM, or the remote patient monitoring, and I think this is related as well to, for the audience or the public, people are not um, uh, physicians or technically or experts in the medical field or medicine field. For anyone to get more confident in this kind of service powered by the AI. So my question is, what the advancements in the AI powered RPM have you observed? What are the development happens? What are the how this can be more convincing for public people to rely on and to use without any fear, without any unconfident to get wrong results, or even to affect their health in some way or another.
So today, I'm no longer seeing patients in the hospital at home. I actually have gone into nursing homes, and in the nursing homes, some of them have adopted an RPM platform called Circadia. And Circadia puts a monitor above the bed of each patient, and this monitor utilizes AI, and it recognizes the patterns of the patient. It recognizes that the patient breathes 16 respirations a minute. So when the patient starts breathing 20 a minute or 24, it flags the patient. Now you're thinking the nurse has this capability, or the EMR, but the fact is the nurse will go and check in on the patient 2 or 3 times a day. This monitor is continuous in real time. So as soon as a patient has a respiration that's abnormal, it'll flag the staff to pay attention to this patient. And the key is to recognize a problem before it becomes a bigger problem, and to treat a simple problem before it becomes a bigger problem. And once again, to prevent the hospitalization. And that would ultimately save the system a lot of money. A lot of these nursing homes are funded by Medicare and Medicaid dollars, which is all taxpayer dollars. So there's a tremendous inefficiencies, and there's a tremendous opportunity to improve the efficiency of how these nursing homes function. That's one.
That
And then
means
there's
that
all
also
these.
like the
Go ahead.
AI can improve the predictive.
Right.
No, I say like the AI can also go in prediction, like
Right.
have prediction models,
Right. Exactly. Like, for example,
like on the
during
behavior of
during
the own
COVID.
patient has its monitor. Like, okay, be careful. Like maybe tomorrow his heart rate will break, or this
Right.
kind of thing, right?
Right.
Right.
Or like, for example, everybody stayed home for about 2 years because of COVID. So for 2 years, people did not get their routine maintenance scans done. Like, women did not get their mammograms. People did not get colonoscopies. So, for example, when Kaiser Health System wanted to restart doing mammograms, they used an AI system to identify the patients that were higher at risk and brought those people back first for them to get their screening mammograms. And the ones that had healthy mammograms, they brought them back later. But the ones that had abnormal mammograms, it recognized them and it helped identify the patients higher at risk. So the AI basically helps risk stratify patients. And if you put your limited resources on these higher risk patients, and you get to them before they have the exacerbations. And some of these RPMs, like the Enlighten AI platform that I advise for, utilizes real-time monitoring in EEGs, and their goal is in time to not just treat seizures in real time, but to predict when somebody's going to have a seizure before they have a seizure, so you can titrate the medication accordingly. That's using an AI engine. And likewise, another platform that I advise for is called Kiva Health, and they use a spirometer, which is Bluetooth enabled, and it allows people to blow into these spirometers when they're having an exacerbation, and they would get feedback from a nurse in real time before the exacerbation gets worse, once again to prevent a hospitalization. This is happening amongst every discipline. It's happening in cardiology, it's happening in endocrinology, it's happening in everything. When I say endocrinology, nowadays there's CGM, which is continuous glucose monitors, and that's occurring. There's even people who are not diabetic that are using CGMs just so they can monitor their own blood sugars, so that they're aware of their daily habits of eating, so they are more cognizant of the foods that are causing sugar spikes, insulin spikes, and it allows them to monitor their own blood sugars in real time. And if it's done correctly, it can be done to help prevent diabetes, as people are more aware and cognizant of what foods are deleterious to their health.
Interesting. I think this highlights how the patients
That's
can
good.
get the impact of using this kind of AI powered solutions, not just to save costs. Definitely, that's very important, but even for the patients themselves, they get a direct value of getting predictions about their health and giving them, like, alarming them or even their relevance if they are old people or something like this. But this is very, very adding value to control how our health is evolving or affected by any kind of external factors.
Yeah, it goes to like we already like talked a little bit about it, like how AI can be cost effective. And if I go back, like for example, to the diabetes, how like if we go more specific, because I think it's very broad question, like on chronic disease, how can AI like be like may gain money and be cost effective for patient, for the governments, for everything. Like that's why I'm talking about diabetes, because you just talked about it, but we can see like in this slide. Can you go a little bit more into that, Ramin?
Well, diabetes, like I said, is the CGMs, and people have insulin pumps, and insulin pumps also utilize a CGM, which is continuous glucose monitoring, to monitor the blood sugars. That's the only area that I'm aware of, but I'm sure there are other areas within endocrinology that I'm not aware of. There are also, people nowadays have, for the field of cardiology, people have loop recorders. Loop recorders are like Holter monitors, where they monitor somebody's heart rhythm. But these loop recorders are the size of half of a pen. So it's a very small device, and it gets embedded into their chest cavity and with the wires into the heart. And these little loop recorders actually have a 5G chip embedded. So in real time, the cardiologist gets the recording. And if somebody goes into an arrhythmia in real time, the cardiologist is notified. So I have seen patients in nursing homes that I knew they had a loop recorder, but from my point of view, they were stable. And next thing I know, the cardiologist is calling on the phone and suggesting we put the patient on diltiazem or Eliquis because they've gotten to AFib. And they know that because they've gotten a warning in real time through the 5G chip. And this is, it generates a tremendous amount of data. And this is where the AI comes in, is the AI will sift through this data and point it out to the cardiologist. And, it allows us to treat the patients before they develop a heart attack or a stroke, and prevent a lot of problems if it's done correctly.
Interesting. Yeah. I might share it as well here. This that's you know, I have like a very close member in my family was having similar case like what you're explaining, but that was very personal. I used like the traditional or the very public used AI tools like GPT, ChatGPT, or even Go Gemini. Just added all the analysis, all the echo reports to this kind of AI, and honestly, it analyzes all the details of the case. That's before we see the doctor to give us some direction or some suggestion, and even it explain in a very detailed way all the scenarios that might happen in that case. What is the easiest way, or what is the very simple actions we should take, or what is the most complicated action we might reach to. It depends on multiple scenarios. It was a bit scary at the beginning, but when we discussed with the doctors who's following the case, and they advised us on the actions, I was very surprised that they exactly said what the AI told me.
Yeah.
Do you think this could be like a public use case for people who would like to get more confident, or even to be more aware about their health situations by the analysis or kind of things, or this might direct the people to a wrong direction of being following just the AI and not asking human expert or physician or
Well, that
doctor?
happens unfortunately all the time. I mean, even before
Mm,
AI, there was Google, and people call it Dr.
Yeah, I
Google.
remember.
And
Yeah,
people,
remember.
as long as I've been a doctor, would Google their health conditions, and they trust what Google says. But you got to understand that's just a starting point, because at the
mm,
end of the day, you have to go with the trust of the physician who has years of in-person experience.
mm,
Um, but yes, that is happening. Today, people have smartwatches. I myself have a Pixel watch, and all the smartwatches have heart rate monitors, and they have some of them have fall detectors. And
mm,
this allows the people that can afford these smartwatches to be more proactive in monitoring their own health, and hopefully treating exacerbations before they become bigger, um, for people that have the means. And then the people that don't have the means, there is this safety net of like what I describe as the RPM system, which is
mm.
generally, Medicare funded, which is all of our
Sure.
taxpayer dollars. But there's a tremendous inefficiency, and if it's done correctly, it can be done well.
Interesting.
Yeah, that goes to like a question like we had in we started to overview in the last talk was the ethical part of the AI, the usage of the AI in the healthcare, like how ethical considerations and where to apply. One of the thing I remember we talked about, but we wanted your input is like we were taking the example if a doctor uses AI to reply or to give a prescription to a patient and he doesn't tell him how much would it be like not better but ethically speaking, like if the patient used directly an AI, is kind of the same, or the other way around is like the doctor can say yes, I'm using AI because it helps me go faster, I treat, and then it's about transparency. So we have like this ethical part which can be a huge topic, but I wanted like your endpoint or your vision about like these ethical considerations.
Well, I mean, the ethics behind it is, there's a camp out there saying AI for good, and unfortunately, whenever there is technology out there, there are people that leverage the technology for maleficence or bad behavior. I mean, unfortunately, um, as long as there have been doctors and patients, there's been insurance, and there's been prior authorizations, and there have been denials. And recently, the case of the United Healthcare CEO Brian Thompson, who was murdered in part because of all the frustrations that Luigi made. And this is a frustration that is universal amongst most people in America. They don't feel the healthcare insurance system works on their behalf,
Mm,
because it's a profit-driven system. So likewise, these insurance systems do utilize AI, and they utilize AI to make more denials, and they've made people's lives more difficult. That's
Oh,
so that's a very bad example, um, in my opinion, maleficence, but at the end of the day, it's part of their business model. Unfortunately, their business model works on them sometimes denying care or rationing care, which is something that I don't think the public truly understands. Only physicians and healthcare workers are the ones that really understand the frustrations of what the healthcare insurance companies do. But if you have responsible children that are trying to look after their elderly parents, there are a lot of AI tools out there that can allow them to do their own remote monitoring of their patients, of their loved ones remotely, and that is another example of leveraging technology to make their own lives easier.
Interesting. I think that this takes us to another point of view from applying the AI or implementing AI for the providers themselves. How do you think and see the challenges that might face the providers when they try to use the AI or implement the AI in their systems? And how do you think they should overcome such challenges?
So, I mentioned that there's currently less doctors that have the certification of AI than there are astronauts. So there's currently 676 astronauts, so there's less doctors. And just as in medical school, they don't really talk a lot about the different aspects of the healthcare system. Even today in 2025, there's very few medical schools that have AI integrated into their curriculum. Even though every single one of those medical students that are going to become doctors, even if they're not going to be clinicians, if they're going to work in healthcare, they're going to be working with AI in some aspect. And these medical schools are not just behind the curve, they're doing a disservice because they are not discussing necessary technology. And I know the ABAIM has made tremendous strides and efforts in trying to integrate an AI curriculum into the medical schools, but they get a tremendous amount of pushback. Part of the problem is these medical schools are run by academicians, and these academicians practice medicine in an unrealistic environment, which is an academic medical center. They're not the ones out there running a private practice. They're not the ones out there running how a community center should be run necessarily. For the most part, the business aspect of healthcare is really not talked about in medical school. And it's not encouraged to, at least it wasn't when I was in medical school. I think things might be changing now, but there needs to be a tremendous push to integrate AI not only into the curriculum, but just as doctors need to get CME, which is continuing medical education. Being a physician, you're a lifelong learner. You can utilize some of that CME to learning more about AI in healthcare, and you have to direct your own education to a certain degree, and you got to take ownership. And by having a little education in AI, it can very easily make you stand out from the crowd, especially in the health systems where so few physicians, and I would say that even very few administrators really understand how AI in healthcare really works and how they can use it to their benefit.
Interesting. So the starting point will come from the intention to learn more about AI, to understand how it works, and to get the benefit out of it for their sake. That, and from your experience, I know that that's where you're coming from. But how do you think physicians should get this kind of education or learning, even if the education providers, universities, institutes still not taking an aggressive actions to involve the AI in their curriculums, but for physicians themselves, is there a way for them to get this knowledge?
So in my opinion, the gold standard organization out there is called the ABAIM.org, which is the American Board of Artificial Intelligence in Medicine. They are the largest governing body that provides education for physicians, but there's other organizations. MIT has an AI in healthcare program where you get a certificate. I believe Stanford now has one, and more schools are adopting AI as their curriculum. I think Harvard now has an AI curriculum tracked for their medical students as well. But there is a lack of resources out there. But there are these 3 or 4 organizations that I've mentioned. I actually have also talked about this topic in other podcasts that I have done. For example, I did 2 podcasts on Heather Fork's Carpe Diem podcast, where I actually mention all the resources out there. There is a tremendous amount of free resources on the internet. There are online courses through Coursera that are free, that are led and taught by physicians. Nowadays, with most people having internet access, there's a ton of resources at people's fingertips. They just have to look for it.
Interesting.
Yeah, right.
Yeah.
And it goes to like, I want like to see your vision on what's for you like the future trends in AI and healthcare, like on specific domains. What's your vision since you're into it?
So for me, in being in primary care and hospice, there's still a tremendous amount of work to be done in interoperability of the EMRs and data sharing. That's the biggest area that I'm trying to do some work on, as well as adopting RPM technology. A lot of physicians are not aware of RPM technology. But the lowest hanging fruit, as I mentioned before, are the image-rich fields like radiology, derm, ophthalmology, even pathology. Today, there is a machine, and the machine actually is in Mount Sinai Medical Center. When they are in the operating room and they take out a specimen, and before they would give that specimen to the pathologist to see if they have clear margins, it would take them maybe an hour or 2 to get a reading back from the pathologist. There is a machine in the OR, and the machine will let them know in 5 minutes if they have clear margins or not. And then the machine is basically doing the job of a pathologist, and leveraging technology to expediting healthcare. So that is a big role. There is also a tremendous lack of physicians in rural areas, and these rural areas sometimes have to leverage telemedicine more. They might have to utilize RPM more. So that's where AI is going to have a role in that to play. And in the big cities, the biggest role for AI is interoperability, because even in a large city, Henry Ford Medical Center may not be on the same page as University of Michigan's health centers. Their EMRs may not be talking, and that needs to change. That needs to change so that U of Michigan is talking to UCLA, is talking to Texas University, and all these academic medical centers are all interoperable, and that is still not happening, but it needs to happen.
Yeah. So if you can say, like, if you want to find a job quickly in the next coming years, so work in the AI RPM field, you'll find a job. You have a lot to do.
Well, yeah, I mean, a lot of it is finding your niche, finding your interest, and it's a lot of networking. Like anything else in life, it's sometimes not what you know, but who you know. I mean, when I went to medical school, there was no AI. I didn't know what AI was, but AI was existing back then. It did exist, just people did not know about it. When I was in medical school, the Palm Pilots came out, and I was one of the first 3 people in my class to use a Palm Pilot. And when I started residency, that's when Palm Pilots became popular and they became ubiquitous. And when I became an attending, that's when smartphones came out. And I'm only 50 years old. By the time I'm 65, I think the entire healthcare system will look different. So we'll see what happens.
Really fast.
Interesting. So that takes me to I think this could be like the closing question. For your advice for the organization side, you advise the individuals or the physicians to learn more. Even the institute still not ready with the curriculums, but for the organizations who provides the healthcare service. how do you think, or how do you advise them to think of implementing the AI solutions in their care delivery models?
So ultimately, AI has to be customized for every single health system and uniquely. What works at Cedar Sinai may not work at UCLA, may not work at University of Michigan.
Mm.
So the health systems need to pinpoint their pain points and develop AI solutions. And
Mhm.
ultimately, just like there's multidisciplinary teams that solve problems where it's clinical or something else, they will have to develop multidisciplinary teams where an AI team consists of a physician, a data scientist, and other people that help gather the data to develop an AI solution to the problem. And the larger medical centers like Mayo was trying to create their own AI solutions, and they recognize it's too difficult because it was an expertise domain that they didn't have knowledge of. So they partnered with Google, and
Mm.
Google is helping them provide the AI knowledge that they need. Likewise, Duke University was trying to do the same thing. And even though they're a large academic medical center, they lacked the AI knowledge, and they partnered with Microsoft. And these partnerships are blossoming more and more. And there's going to be more opportunities, and physicians should not be afraid to step up and if they're interested in a leadership position or some kind of an advisory position, I think there's a lot of opportunity out there. But it's a lot of the wild west. It's a lot of untracked territories. It's a lot of unsolved problems, and
Mm.
um, you'd rather do things slowly and do them correctly than do things quickly just for the sake of having a solution, which
Yeah.
is what the EMRs did. The EMRs, I think, did more harm than good. And that's the problem, is a lot of this technology, if it's going to be done correctly, it's actually going to take years and years of training to be done correctly, because you can't have AI systems that are misleading a patient's care. You cannot have AI because there are hallucinations. And
Yeah.
ultimately, this
Yeah.
is why doctors will always have a job, and there will always have to be a
Yeah.
human in the loop. And
Hmm.
people are thinking, well, doctors are going to get replaced by NPs, but NPs cannot do operations. NPs have a limited scope of practice. You're still going to have a need for physicians and these specialists, and AI is not going to replace anybody. It's going to augment everybody's job.
Interesting. That's a very adding value. I think, the merge between the technology always is there, but AI coming to the scene is accelerating how the technology can evolve the healthcare, and even the healthcare service and providers and organizations definitely will accelerate the value they bring to the patients and the users with more confidence, with the integration between both. I think you're 100% correct, especially in the healthcare area. The AI might replace other jobs, but not physicians, not doctors, because at the end I need to talk to a human doctor to discuss more details about my. That's part of part of us being human, being discussing our feelings, our emotions, our pain in our body and our body system. I think AI definitely can add value, but it's not replacing human doctors at all.
Yes, I agree with that.
Yeah.
That was a very exciting, very adding value.
Yeah.
Learned a lot, honestly,
Yeah.
from.
Yeah. That's
Yeah, that's an eye opener, honestly. And even when you're talking, I'm trying to reflect and realize how can AI add value more, how the technology can change what the infinite opportunities in the healthcare. When we're talking about AI, how can it add value to it? I guess this could be like a separate talk. We can discuss even offline with you more about this, and see how other things we need to learn from you about. Thank you
Yeah, I
for
mean,
so.
finally, we didn't talk about, but there's a lot of role for AI in drug discovery, in molecular research. So it has roles to play in every aspect of healthcare. Like I said, It's a $4 trillion industry, even in medical devices, and there's a tremendous amount of waste. And if AI, right now, if a new medication comes to market, it costs over $1 billion in R&D. With utilizing AI, creating digital twins, they can actually develop medications for less than $200 million. So for that same $1 billion, they can come out with 5 new medications out. And with digital twins, they can also do studies online, and it'll expedite the progress, hopefully, if it's done correctly.
Yeah, there's a
True. True.
There's a lot of road to do, and it opens, like you said, a lot of opportunity. It was very insightful. I mean, we learned a lot during this talk, and it was you took some words that we understand, because I think in your background you could have been a lot more complicated, but for the audience it's perfect. So thanks a lot. I mean, thanks a lot.
My pleasure. Thank you for the invite.
Yeah.
Thank you so much. Thank you.